Hello. Good morning slash afternoon slash evening, depending on where you are. Happy Wednesday as well, fellow veterans. My name is Veteran Coach TJ. I will be hanging out with you for the next hour, and I am joined by my esteemed colleague and friend, Coach Tony. How you doing today,
Doing
Tony?
good, brother. Doing good. Weather's dissipating. Many prayers for folks here in Texas. Definitely seeing a lot of great fellowship as folks are trying to help other people out.
That's right. That's right. Couldn't have said it better myself. And as you know, being in the Central Texas area as well, it's been a crazy last week. That is for sure. We hope everybody out there is doing safe, doing well, and we are happy to spend this next hour with you discussing a very, very important and very common topic amongst the veteran community, which is orthopedic conditions. But before we get into the specifics, we're going to give it a few more minutes to let the stragglers trickle on in. So they can have their time to grab their coffee, their beverage of choice, whatever it is that you need to get through this. And while that's happening, feel free, everybody, as well, throw into the comments where you're tuning in from, your branch of service, the years that you served, all that type of stuff. I always like to say I love to see my fellow Air Force veterans chiming into the chat. Not that it's a competition, but
That's
sometimes
right.
it is.
Go Army, baby.
That is right. And immediately the Army chimed in. It's the first one I see there, so I set myself up for that one.
That's right. You were our little baby, and eventually we let you go off on your own, Air Force.
We were finally allowed to be unsupervised. Uh,
Right.
Good stuff.
Although we always envy your budget, right?
Yeah, four-star hotels on the bases and all that type of stuff. We got the works. We really did.
That's right. That's right. Welcome in. Welcome in. I see we got a Marine, Navy.
That's right. Several navies.
There we go.
Welcome. All right. Yeah, welcome Will and Alicia. Alicia, hopefully I said that right. Um, a lot of Navy. Look at this. Representing well. Infantrymen. Good morning to you, sir, from Las Vegas.
There we go. I'm not alone. There's another infantryman in the room.
Yeah, irony is taking its toll on me right now. Where are my Air Force people?
All by yourself.
All by myself. Izzy, welcome from San Diego. Awesome. Ron Brand, welcome. Chuck, Michelle. Ed might still be. Oh, is he? I wonder if Ed is saying the Air Force people are still sleeping. That's what he meant by his comment, because can't fault them there. That's pretty funny.
Yeah.
Can't expect us to wake up before about, I don't know, 11:30 a.m.
Oh,
It's,
there you go. You're not alone. There's Margaret. Air
hey, there we go.
Yeah.
We are here. Ed said yes. That is exactly what he meant. And while people continue to trickle on into the room, I'll go ahead and go first. I'll just give myself a quick little introduction to everybody. Like I said before, my name is Coach TJ. I am an Air Force veteran. I never was an elite member at VA Claims Insider previously, but in my previous jobs and professions and all that type of stuff, I was going through the process, the disability claim process, and learning a lot about it as I went. And soon after that, I really kind of developed a passion for trying as much as I could to help, my friends, my buddies that are also veterans that wanted to learn more about the claim process and all that type of stuff. And so I developed a passion for it, and eventually an opportunity came up with VA Claims Insider. A previous employee here, his wife is actually my financial advisor. That's a little fun fact. That's how I got connected into VA Claims Insider. And so uh, eventually I was fortunate enough to get a job here as a coach. I have absolutely loved it ever since. Best job I've had ever since I got out of the service, and it's not even close. And I'm super happy to be here. And I'll kick it over to Coach Tony if you want to give a quick little intro for yourself.
Yeah, absolutely, TJ. Thank you so much. A lot like TJ, I wasn't a member prior to. I'm a retired Army veteran myself. Went through the process. Thankfully, knock on wood, I was 100% permanent total going out the gate. And so took a little bit of time off to relax or try to figure out what I wanted to do when I grow up. And I stumbled upon this great organization a little over a year ago, and thankfully been brought on board, and it's just been an absolute blessing. So many servicemen and women every day that we are fortunate enough to be on their journey with, and it just really kind of fulfills the me. I was looking for something kind of like I did in service, connecting back to that servitude of others is what I really missed after leaving the service. And so, truly appreciative to be a part of this organization. Thank you.
Yeah, that's a good point, Tony, as well as the camaraderie, the that culture and just that's what I miss the most. And, getting the chance to work here and constantly be in communication with fellow veterans who are going through and have gone through, similar things that I have, that we have. And, it is truly a pleasure and a calling to be able to do that. I feel very lucky on a daily basis. Definitely.
Yeah, absolutely.
All right, I'm seeing more Air Force people here. There, Anthony checked in. Anthony Cleaver, 32 and a half years active in reserves in the Air Force. That is amazing. Michelle's in here from the Army. Welcome. Hey, we got a Coast Guard. We don't get too many of the coasties from Tom.
Very
Welcome. Good to have you. We're going to give it maybe another minute or so, and then we're going to start diving in again. We are going to go over a topic that I truly think, in fact, I don't know if I've ever met or spoken with a veteran who was not in some way, shape, or form affected by orthopedic issues or musculoskeletal pain. I mean, you think about, what you do in the service with the different MOSs and jobs and all that type of stuff. It's hard to not be affected in that way. And so that's what we're going to go over today, and it is going to be very informative and very relatable.
Yeah, absolutely. Every time the weather shifts, I'm reminded of all the wonderful percentages I got going on from head to toe.
That's right. You usually have an inkling of when it's going to get cold or what's going to happen ahead of time. And uh-oh, here it goes.
That's right.
All right. Well, with that being said, we've got a lot of this is a nice turnout. A lot of people tuning in here, so we get the chance to educate and communicate with a vast group of veterans. That is amazing. With that being said, I'm going to go over a few details here before we dive into the specifics. Um, so, a little about if you do decide to join VACI's elite program. It's a great program, but if you do, you're going to get assigned to a coach, a veteran coach like myself or Coach Tony, and you will get one-on-one coaching throughout your entire claims journey with that process. And so we use an acronym, SEM, which stands for Strategy, Education, and Medical Evidence. Those are three pillars to any VA disability claim. But that whole process is what you and your coach are going to come up with together. That strategy, that game plan, figure out what it is that you're going to go for, figure out what you need to do, to get medical evidence and documentation, and you're going to have the education and the understanding of what that means and how to do it. Uh, there's also coaching through the claim submission education process. So that's when you will be submitting your claim. And then, of course, we have the C&P education. After you submit a claim, the VA typically will send you to a C&P or compensation and pension exam. And we will work with you to get you educated prior to you doing anything like that as well. It's a very important piece of the puzzle. Uh, we also have live classes via Zoom for the elite members. Three different ones. There's coffee with the coaches, which is really, really a great, part of it because there's no real topic, there's no real specific kind of thing for the coffee with the coaches that happens. It's just a live Zoom class where you and the other veterans, you all just come in there. There's a couple coaches in there, and it's just a hangout. It's just chatting about whatever comes up. It can be claim related, it can be life related, so on and so forth. But really good sense of camaraderie and community with that class. And then we also have the mental health exam education classes if you're doing a mental health claim, and the medical exam education classes if in fact you're going for something that's a physical condition, musculoskeletal, so on and so forth. But if you're interested in learning a little bit more about the elite program, please schedule a discovery call. They're going to put that link up there that you'll see, but during that call, you'll be able to speak to one of our team members. You'll learn a little bit more about, the elite program and kind of figure out if we're a good fit for you and vice versa. But we would love to have you. And with that being said, I will kick this over to Coach Tony.
All right. So just as Coach TJ had alluded to at the beginning, in case you missed it, our main topic today is to discuss veteran orthopedic conditions, conditions that are near and dear to my heart and throughout my body. But we'll go ahead and kick it off here. Orthopedic conditions is anything relating to dysfunction or pain of the bones, joints, muscles, ligaments, tendons, cartilage, or with bodily movement from a musculoskeletal standpoint. Orthopedic problems involve, but not limited to, often soreness or rigidity of muscles and joints. Some commonly affected areas are knees, hips, back, shoulders, elbows, wrists, neck, feet, and ankles. When looking at these types of claims, it's important to know that you do have options. The more you know and the more you educate yourself, the more likely you are to get what you are entitled to by law. And I'll shift it back to TJ to continue talking about some of these common orthopedic conditions.
That's right. Yep. Thank you. And so, these orthopedic conditions, they're affecting every aspect of life, right? For those that are struggling with it, um, the military lifestyle is I mentioned earlier, it's a rough one, right? It's run and gun. It's hard on the body. It's carrying equipment and PT and doing all that type of stuff, and that can really take a toll on your joints, make your joints age a little bit quicker, quicker than what you're actually aging. And so it's, like I said, very common. But I'll go over quickly three of the most common ones, that we see amongst veterans, with one of those being sciatica, also potentially known as or labeled radiculopathy. But really, it's that sciatic nerve pain. Now, this can go, you can get that nerve pain that shoots down into your legs. It can also, go into your upper extremities. It can shoot into your arms. But that is a very common one. When your joints are inflamed, then therefore so are the nerves, that are connecting to that. And so that's what causes that to, kind of shoot into the extremities. And there are different types of, treatments. There's medications you can take to manage the inflammation and the pain. There's different stretches, exercises, and stuff like that you can do, physical therapy related stuff. And then, of course, you've got like heat and ice pads and things like that can help. But in the end, most of the time that's just to help manage it. Typically, it's not just going to completely get rid of it. But for sciatica specifically, there's a couple, different potentially high ratings that you can get for that. Right now, the VA uses their medical terminology. 60%, for example, if service connected, is what they call incomplete paralysis, which is severe with marked muscular atrophy. But then there's 80% that it can potentially go up to if you've got documented complete paralysis. That's kind of the main difference there between those two ratings is, incomplete or complete paralysis. And then we'll move into arthritis, another very, very common diagnosis amongst the veteran community. That is the degenerative changes within your joints. You might have some joints that are more affected than others. Doesn't have to just be like a whole body thing, but um, almost everybody at some point in their life is going to deal with arthritis. But especially in the veterans community, constantly being on your feet, constantly being on the go, carrying all the gear, doing all the marches and the PT and all that stuff, right? It typically, speeds up a little bit when it develops. And so, you can get treatment from your VA doctor, private doctors, whoever it is that you prefer, but they can, kind of help you out with the treatment, with the therapies and different things that can at least make it not as severe. But when it comes to claims, for arthritis with the VA, you're usually going to be looking at those rated at 10, maybe 20% if they are service connected, depending on also how many different joints you have service connected with the arthritis. But they're going to look at X-ray evidence. They're going to be looking at all that type of stuff to determine the ratings and things like that. And then on to the third one that we will be discussing is the lower back pain. I can not guarantee, but I can probably almost guarantee that most people tuning in right now are dealing with this or have dealt with it at some point. The lower back pain, very, very common. In fact, it's the most common one amongst veterans. And so, that can have a lot of impacts on your life, affecting your mobility, and really just affecting your ability to function on a daily basis in general, as with how severe it can get. Now, there's of course rehabs and therapies and medications and things like that that can, potentially surgery. Hopefully, we hope it never comes down to that, but there are those types of things that can help with it. But again, these are not just the only ones; these are just the most common, right? Because we understand that there are neck pain, there's knees, there's ankles, elbows, shoulders, feet, the whole 9 yards there. So those are just three of the most common ones, and I'll kick it over to Tony.
All right, so what do you need to claim an orthopedic condition? So before filing for an orthopedic VA claim, most importantly, you must have a current diagnosis within the last 12 to 18 months, okay? You must have a service event or nexus to an in-service event and a medical examination that is in line with the 38 CFR. Now, when it comes to the 38 CFR, what is it? Well, it is the Code of Federal Regulations and what the VA utilizes to determine what your percentage should be for disabilities. There are rating criteria and diagnostic codes for every single condition ratable by the VA. The VA has determined what objective measures are utilized to rate conditions. To better prepare yourself for your VA claim, it is very important to spend time on the 38 CFR webpage, learning as much as you can about the VA rates you currently have with a diagnosis. I like to refer to it, Coach TJ, as doing my homework. That's what I did prior to ever filing my VA claim and something that is very common within our organization is, getting to the doctor. You got to get to the doctor. The longer you put off those conditions, specifically since when you have exited the service, the longer it is, the more difficult it becomes. Not impossible, just difficult. Just remember, you first need a current diagnosis and medical evidence to back up your injury. Um, Moving on to the current diagnosis, one of the major things you need for that claim to get approved, as we talked about, is the medical diagnosis. Without this, bottom line, you do not have a claim. What does it mean to have a current diagnosis? Well, it means that somewhere in your medical record, the actual diagnosis is documented. Now, let's explain in the terms of the example that I'm going to provide. You injured your knee during combat 20 years ago. but you did not get seen again for that knee condition. That alone will be a hard case to get the VA to approve the claim. Likely, you self treated and lived with the pain, as many of us tend to do while on active duty and moving into as veterans. 20 years ago goes by, and you are now experiencing increased pain in the same knee. You will see your medical provider to address the knee pain and provide a treatment plan. This is the current diagnosis, and it will be documented in your medical record or note from that visit. It might say diagnosis like knee strain, arthritis, or degenerative joint disease as examples. One of the biggest things we see missing in medical records is the current diagnosis. You just cannot tell the VA you have knee pain. It has to be documented by that medical provider that you have recently seen. Now, moving on to that current diagnosis and how it needs to be documented. When you see your doctor, make sure that you actually get the diagnosis written in your documents. You may request your medical notes from any provider you see, and we recommend you read through them to find the diagnosis. If you sign up through the program, you get assigned to a coach. You're not 100% sure. Hey, do I have a diagnosis, be it through private medical records or VA medical records? You will be able to upload this through your Insider Portal account. Once you activate your Elite Program Insider Portal account, you'll be brought to a dashboard where you can upload those documents, and you can absolutely ask your coach to review those to see if you do, in fact, have that current diagnosis. But what if, and this is a common question that is kind of thrown out there, but what if my doctor will not give me a diagnosis? You do not have to tell your doctor what you need this information for. You can go to your current care orthopedic doctor or a specialist and tell them about the issue you have been having trouble getting pinned down. These appointments do not have to be done with VA medical providers. Common misconception is if you don't go to the VA and get that health care, you're not going to be able to go after claims. Absolutely not true. Private medical evidence is okay. It's entirely up to you which path you choose to go down that best is fits with what's in your household. Oftentimes, veterans utilize their non VA medical insurance and see civilian providers. You may prefer this route and be sure to request the medical records to upload with your claims, okay, with your claims. So once you go through that process, you've got all your medical documentation, you're ready to move forward with that submission. It's very critical and important that you share, if you are using private medical records, that you share that with the VA versus just providing the information of where those records are located. That tends to slow things up a little bit, with the VA. And then I'll shoot back over to Coach TJ. He's going to tell you how to get a secondary service connection. Very critical and important for your orthopedic condition. Go ahead.
That's right. Yeah, the secondary service connection is a huge piece of the puzzle, and I'll go over exactly what that means. But the bottom line here is that, everything in the human body is connected to something else. I'm sure that everybody's heard the song growing up, right? We've all heard that, the knee bone connected to the. I'm not going to sing it. I'm sure there's high demand for me to do that, but I'll resist the urge. But yes, that is true. That's why it exists, right? Everything's connected to something in the human body, and so what that means is, here's an example. Let's say you injured your knee when you were in the service. You have a 20% rating. Let's just go with that example for your knee. And over the years, because of that knee pain, it's caused you to, your gait is a little off. It's caused you to walk a little funny. You're shifting your weight unevenly, disproportionately. And over the years, that takes a huge toll. And next thing you know, your lower back is on fire, right? Because your back has taken the beating um, through that process. And so then you can potentially claim lower back pain in that example as secondary to your knee pain, which is already service connected. Now, it's very important to also keep in mind, if you do not have a rating currently for your knee, then you cannot claim back pain secondary to it. You have to have a rating for whatever that primary condition is first. But that is how you kind of put the pieces of the puzzle together for these secondary claims. And so typically, and the best way to do it, you want to have medical evidence that speaks the VA's language, right? Medical evidence supporting this claim, if this is what you're doing, that speaks the VA language, because when you do that and you provide that with your claim, you're making it as hard as possible for the VA to push back on it. When you're giving them that solid medical evidence, it's very difficult to dispute. You're making, you're putting the VA in a situation where there's, overwhelming support to potentially approve the claim. Now, oftentimes that medical evidence can include a nexus letter. And so a nexus letter, nexus, that's a fancy word for connection, right? But it is a letter from a medical provider that explains in their own medical professional opinion how and why they believe that a certain condition is related to service, or how a certain condition is secondarily related to another condition. Okay. And if you do sign up with the Elite program, we do have a preferred provider network called Telemedica. They are a separate company from VA Claims Insider, but they specialize in that exact thing. You're writing up Nexus letters, speaking the VA's language, all that type of stuff. And so you and your coach, if you do sign up, will go over everything. And if that's a good fit for your situation and your claim, you can go that route. But it's crucial. Medical evidence. I said it earlier, strategy, education, medical evidence. The medical evidence is key. Just like Coach Tony was saying, whatever it is, get it diagnosed. Please get it, go to your doctor, get whatever it is medically diagnosed, and grab those treatment and diagnosis records. And then, you move on to the next step. And with that, go back over to Tony here. He's going to be talking about potentially what else can be filed secondary orthopedic.
Absolutely. Before we do, I do want to point out this comment that the infantryman here said, how can you do it without any proof in the medical records? How can you do it without any proof? And bottom line up front is, if you don't have it in the proof in your military medical records, the probability is extremely low. I won't say none, but it's a small percentile that if you don't have that, and sometimes that happens. We've all lived it. If you grew up, in the military, well before the 2000s, suck it up and drive on. Don't go to sick call. You're wasting time, and all those other things that kind of came with seeking care really impacted a lot of our older veterans' ability to file, particularly for musculoskeletal type, orthopedic type claims. But bottom line, yeah, it's kind of a done deal, if you will. And I would tell you too, the most important thing, particularly if you sign up with the program, the coach is going to provide that education and the resources potentially to discuss other claims that you can get your foot in the door if you don't have a rating, and or potentially go for some increases or some other things that for conditions that you're already rated at. So moving on to what else can I file as a secondary orthopedic condition? These next few conditions are really related to orthopedics, but not actually the same. This is what we like to call secondary conditions, meaning your primary service connected disability was caused by another disability. For example, we are often able to tie gastric reflux back to orthopedic conditions. Why is this? Well, if you have knee pain, back pain, and have been taking Motrin for years, now you have this gastric reflux from the chronic use of Motrin. You may not even know that, because taking it is the link to developing the gastric reflux. This is a link which the VA recognizes, and it has to do with medical facts. As Coach TJ had alluded to earlier, talking about this wonderful word called radiculopathy. It is another commonly secondary condition. These are symptoms include things like numbness, tingling, down your legs, down your extremities, or even things like bulging discs in your back, which may have resulted in numbness and tingling down your leg. You have to get that current diagnosis of that, just like every other claim. You can't just say, I have this thing. Can you write me a nexus letter? You need to go to the doctor and absolutely have it documented. And so, Coach TJ, what do I do if I think I have orthopedic pain?
Great question, Tony, because like I said, I was saying earlier, most veterans have got this. I don't think I've ever met one that doesn't. So if you're sitting there right now and you're like, yo, yeah, I've got all kinds of orthopedic pain going on, we have said this before, we'll say it again, go to the doctor, right? If you've not been to the doctor and gotten these conditions diagnosed within the past 12 to 18 months, like Tony said, go to the doctor, start that paper trail, start getting it documented and diagnosed. That is always going to be the first piece to the puzzle when it comes to doing a claim. Um, and then once you've done that, or if you already have done that, talking to an expert like a coach, about what it is that you can or need to file and claim for is a next crucial piece. That coach will go over, or just the expert, whoever you're talking to, will go over what the best pathway for you is when it comes to those secondary conditions, what additional medical evidence you might need, and just kind of coach you through that whole process. But this is, something that is extremely important because almost every veteran that's ever done VA claims has gotten to a point where they have been denied before, right? You claim something, you feel like it's strong, VA denies it. It is crucial when that happens to not just give up, right? And this is actually a really good example of that. So let's say you go to your barber or a hairstylist or whoever it is, you get a haircut and they totally mess that thing up, right? It's a horrible haircut. Well, you're not just going to give up and never get a haircut again and just totally let everything go, right? You're going to do it a different way. You're going to maybe go to a different barber, so on and so forth, because you're going to continue to get haircuts. Well, you should look at VA disability claims the same way. If you've been denied, it's not a one and done, end all be all. You can never file for it again. That is not the case. There are other ways to do it in most scenarios. You just have to have that education and that coaching in order to go about that. Okay, but um, and this is the same thing for getting care for your injuries. Medical providers, they don't expect you to just live in pain. So if you're going to a doctor and you're not getting documentation that you would like, or you're not getting the diagnosis, or you don't have a good working and professional relationship with that doctor, find another medical team, whether that be, like Coach Tony said, the VA, private doctors, so on and so forth. But find that team that will listen to you better, that will provide better documentation for you, that'll get you, better care, better therapies, all that type of stuff to get you what you need and where you need to be. Coach Tony, let's talk about a little bit about how these veterans can get that care.
Yeah, absolutely. Before we do that, I really like what Mark Kindle had posted here in the chat. And he's absolutely correct, Mark. With the diagnosis, DBQ, and symptom documentation and nexus, even though they deny, you will win with every high success on the higher level review. Most important thing, when you get a decision letter back that denies your claim, don't just look at that first page and say, oh, they deny my claim, forget it, I'm done. You got to go down and look at the evidence, where they looked at the evidence, the favorable findings and information like that will really kind of tell you why they denied you. And oftentimes, folks forget, right? We as service members forget um, that people that work at the VA are humans. They do make mistakes, right? We all make mistakes. None of us are perfect. And so, sometimes folks will deny claims, and it's out of, um, you know, misunderstanding of the claims process and or the adjudication of that. So sometimes the evidence will be there in your favorable findings that they should have approved it, and that's what that higher level review is absolutely for. Great, great, great post there, Mark. So, like Coach TJ talked about, how can orthopedic care help veterans? Well, the main focus of veteran orthopedic care is to offer a natural way of relieving joint pain and distress. Orthopedic care can treat multiple conditions that are common among military veterans. While orthopedic care focuses on joints, tissues, and fractured ligaments, it also helps relieve these following conditions. If you've got all this kind of pain, you may have some insomnia going on. You may have anxiety, mood fluctuation, of course, high blood pressure, right? You're not getting out there and as active as you used to be. Now your cholesterol's high, your blood pressure's high. Chronic pain with the back, joint damage, sciatica, as Coach TJ had talked about earlier. Diabetes as well. Again, that's right there with high cholesterol, often tissue damage, arthritis, scar tissue. But bottom line, the qualified doctors stimulate the body's natural healing abilities to take care of the affected joints and ligaments. The procedure involves non invasive techniques to offer a completely natural approach to healing. Remember, every veteran is different, and what might not work for one may not work for the other. So what works for one may not work for the other, and what doesn't work for the other may work for the next one. And so I think it's kind of closes out some of the topics, if you will, of orthopedics. And we roughly got about 23 more minutes, and this will be a wonderful time to kind of go back through, right, Coach TJ? Look at some of these questions maybe we missed as we were talking so much about orthopedics, and we'll kind of maybe address some of these questions and stuff like that. Now, in the event that we don't get to all of them, please know that our team, even after the live is complete, will absolutely go back in and answer any questions you potentially have if we miss it.
That's exactly right. I do actually see a question here from Lonnie, who says for back pain, would paperwork from a chiropractor suffice? And this is actually a question I've gotten a lot. When it comes to this, the VA will not weigh that type of documentation very seriously. So if that's all you've got, now it can definitely be a piece to the puzzle, but things like a chiropractor and a physical therapist and stuff like that, you don't want that to be your only documentation. The VA wants to see medical diagnoses from medical doctors, medical providers, treating primary physicians, so on and so forth, right? Orthopedic specialists, things like that. So make sure that if you're going this route, that you have more than just chiropractor notes, physical therapy notes, and things like that.
Absolutely. Another great question I see here, which seems to be addressed to me, Keto. I hope I said that right. Keto Tracy, hi everyone from Washington State. What is the CFR I can study? I missed it earlier from Coach Tony. So, bottom line, what is the 38 CFR? The 38 Code of Federal Regulations is what the VA utilizes to determine what your percentages should be. Correct me if I'm wrong, chapter 4, I think it is, right, that covers the individual disabilities in terms of like if you're looking for a condition, again, download it, but also control F. And that's basically what I did head to toe. If I specifically was looking for a condition, I controlled F and dove in and started looking for the condition. It will tell you based off of the symptoms, the VA's rating for that specific condition. Now, some conditions are not cut and dry specifically rated. Sometimes they'll fall under the general list of conditions. So you might have to do a little bit more reading and digging. But if you are definitely getting into this process, the more you educate yourself about that 38 CFR, again, Code of Federal Regulations, the smarter you're going to become about this process. Great,
That
great.
is right. Yeah. And that this is not, that CFR is not privy to only certain or special people, right? Do a simple internet search, Google, whatever it is, you will find that the 38 CFR part 4 right there. And just fair warning, it's a code of federal regulations, so it's not going to be an absolute blast and ride on the roller coaster to read through it. But but it's very informational and it's crucial to the process. Yeah, that's a really really good question. I did see another one here. Let me go back and find it. This is also from Infantryman. He says, and I think this might be relevant to some people that are also watching out there, but he says if you're rated at 100%, can you still file for other conditions? This is where it is not a great idea to do that. Now, can you? Yes, the VA will allow you to, if you're at 100% currently, to file more claims, sure. But it is not a good idea to do so. When you do that, you are opening every rating you've got to a potential review or reevaluation from the VA. So if you're already at 100%, you decide, you can't go any higher, right? There's no 130% ratings. There's nothing like that. So if you're at 100%, just don't do it. That would be the best thing I could say there, but it's not a good idea. You could put everything else in jeopardy.
Absolutely. Now, there are, of course, times where a veteran may feel, even if you're 100% permanent and total, some of the cases that, others have shared with me that I've seen as folks, maybe they get diagnosed with some cancers and life ending type conditions. They may, go for some things like that. Not to be confused, because the infantryman had also said unemployability at 90, but rated at 100%. Definitely a little bit different in terms of if you're, per se 90%, but you're collecting unemployability from the VA that, bumps you up to 100%. You still want to get after those claims to, finally get that 100% permanent and total so that you can stop the fight, if you will.
That is right. Good, really good point there too, because I didn't even see the unemployability, the TDIU. That is a whole different piece of the puzzle there as well. I think I saw one here. Here we go. Hold on a second. My eyes are playing tricks on me. Okay, Elaine. Elaine put a question in here. I've got sleep apnea, insomnia. I've done the sleep therapy at the VA, seeing a psychiatrist for years at the VA, got the CPAP machine, all that type of stuff. But they won't write me a Nexus letter. Now, this is if you get healthcare at the VA, it's very common that this happens. It's very common that a lot of VA providers will want to stay away from that as far as writing Nexus letters. There's no law that says they can't, but from what we've seen, a lot of them don't like to do that. Now they're there to treat you, and they will do that. They'll provide you with all the therapies and the medications and the, CPAP machine and all that type of stuff. But there are third-party companies, and I mentioned this earlier. We have a preferred provider network called Telemedica. They're a separate company from VA Claims Insider, but they specialize in doing exactly that, writing Nexus letters. And so there's companies out there like that that you can look into to see if they can have, take a look at your records and figure out what's going on to see if they can write those Nexus letters. Because, like I said, a lot of VA doctors, I've been told no myself from VA doctors in the past before when I was inquiring about that.
Mhm.
And there's Telemedica's link right there. You'll see it. Check them out. Click that link if you've got the time to do so, and see if that they would be a good fit for you.
So here's a good question by Ed Stitchler. Ed Stitchler says, I'm having a lot of problems with my right hip. My doctor says it's arthritis and bursitis. I think I pronounced that right, these words. I love these medical terminologies. As an infantryman, it's always great to try to read them. They are going to do injections at the end of the month. When I get up every morning, it really hurts. I'm sorry to hear that. Can I file for this? Also got back problems. So the question becomes kind of like we talked about in the education we provided earlier. Do you have a condition that's already rated that you potentially could service connect what's going on there? If not, do you have something, an injury that occurred in service that you can also connect it to? Without one of those two things, it's going to be a very tough time to go after those things. Now, if you do, you absolutely can file for this. Remember again, strategy, education, and that medical evidence. You got to get that current diagnosis, and then you got to get that nexus or in-service connection to go after it. Very great question, Ed. Thank you.
Yeah, Tony, and you had just touched on this a little bit, and I'll even expand on it. That whole you're not alone. If you're a veteran that's sitting out there saying, "Look, it was frowned upon going to the doctor when you're in service. There was a stigma. We were supposed to just tough it out, push through it." And if you're one of those veterans that did that, then and there's no documentation from when you were in the service, then yes, that is going to definitely make that claim a lot tougher. And it may make sense depending on your situation if you're in that boat to pivot and go a different route. And that's where if you sign up for the elite program or you hit up the discovery call, figure out if we're a good fit for you, because having a coach to educate you through that process and figure out maybe there's something else. Maybe there's something else that you can claim that's going to have a stronger chance of success due to the fact that there's no documentation for back pain or any of that type of stuff when you were in the service. That is crucial. But I just wanted to expand on that before I get to the question that I'll address next, which is from Terry McCaffrey. I see here, Terry says, I had a wreck in 1965. Air Force treated your right shoulder. It's not been a good shoulder for you ever since, and now it's looking like it may be replaced, but they don't think it's service related. So Terry, I can't go into super specifics about your situation, but I will say that there are multiple pieces to the puzzle here when the VA is looking at this. And the first one is going to be, now it sounds like you did have service treatment records. It sounds like that is documented from 1965. The VA, when they're looking at that, they're going to sit there and kind of take it from an aspect of, okay, this did happen in 1965, but 1965 was a good while ago, and what the VA wants to see is that chronicity of care. So let's say if you've got medical records from the late 60s, early 70s, and you have them occasionally throughout the years, throughout the decades leading up into the present time, if that exists, right, in those situations, you've got a stronger chance. But if there is a gap, and let's say from 1965 to 1997, you have no trackable, no traceable medical records on that shoulder. Sometimes the VA, can push back on that because they don't know what's happened in that time gap. And this is a situation that a lot of veterans have been in as well. And sometimes it's just, hey, the records are so old that they were destroyed by the provider, or maybe the provider passed away. Those are no longer accessible. Those are common things that can throw a wrench in VA claims. But again, every situation is different. If you get linked up with a coach, they will be able to look at everything with you and come up with a game plan that makes the most sense.
Yeah, absolutely. Bill Mackey's got a pretty good one here. Navy 85 to 90 got 30% due to broken ankles. I can show weight gain steadily since the first one while in. I found straightforward common sense doesn't work, so struggling a little, eventually resulting in a fib and CPAP and, of course, a pacemaker. So sorry for that, Bill. But oftentimes, this is what we like to refer to as a lifestyle impact claim, right? So if your current conditions are impacting your mental health, it's critical and important to, go for that claim, service connecting to the conditions you're already rated, because that condition is impacting your quality of life both personally and professionally. You may not be able to work. and or not be able to do some of the activities you used to enjoy prior to and during service prior to the injury occurring. So great point there, Bill. Thank you for sharing that sensitive information about yourself.
Yep. I will go right into, and again, you guys see the link right there, right? Discovery call. Book that. You've got nothing to lose. Have a conversation with one of our team members about what we do, what we can provide, and if we're a good fit for you. Because this is huge, and your guys' questions are right along these lines, right? They're very, very good questions, and it shows why veterans really, really can benefit from having that education and that coaching. But I had a question here from Sharon Bass. Sharon says, when you say that you've got to have a diagnosis, does that mean that it has to be listed on the problem list? If you can see my quotes there, with the VA medical records, or can it just be in the VA care notes? And this is also very common, right? So in an ideal world, when you pull your VA medical treatment records, every single thing that you've ever been diagnosed with will show up nice and easy, nice and pretty there for you in the problem list section. However, it doesn't always happen that way. And sometimes you might actually have that diagnosis documented, but it's not showing up in your problem list, but it may show up somewhere else, like you just said, within that blue button report, is what it's called, or your VA medical records. I've seen that happen plenty of times. And it just means that you have to do a little bit deeper of a dive. Coach Tony was saying earlier, there's a beautiful trick called Control F, right? When you have your VA medical records pulled up in front of you, Control F, and then you can type in a keyword, whatever diagnosis, whatever condition that you're looking for within that whole thing, especially if it's hundreds or thousands of pages, and just start going through the results from that. And it'll lead you right to all where that word that you typed in, every instance that it exists in there. And so sometimes you will find that a diagnosis is in there and it's not in the problem list.
Okay, Arnold and Pam Layton. See here, I was denied for back pain. I went to the doctor while in the service. I've had back surgery since I was denied and filed again. And looking at va.gov, it looks like I have been denied again. Should I go for a higher level review? There's two paths you can go down. You can definitely sign up to the program. You'll get assigned a coach. A coach will read that decision letter and be able to educate you on, do you potentially have what it takes to go forth for a higher level review. Oftentimes, the letters do tell us, what is favorable for the veteran and what is not, specifically why they denied the claim. In your condition, again, it sounds like you have the in-service event, and the condition has since gotten worse, even though they denied you. Potentially, again, that would be the recommendation. Of course, the other route is you are more than welcome to always, go for a higher level review. It is a little bit more of a lengthy process. It isn't something that is quickly done. Most claims from submission to decision is sitting, I believe, somewhere around 140, 145 dates, and that's just a regular, either a new claim or supplemental claim. When we're talking about a higher level review, that process can take much longer. There are some cases where it's 6 months, a year. It really just kind of depends on if you requested the informal conference to speak to the team coach, and that's the person that will be conducting the informal conference if you scheduled that. But my recommendation, no cost to you, of course, until a claim is won, sign up for the program. Sign up for the program, get with your coach, upload that decision letter. I promise you the coach will review it and be able to let you know. Now, if it's been more than a year, you're out of tolerance. You have 1 year from when a claim is denied to submit that higher level review. And if that time has since passed, unfortunately, you're going to have to submit what's called a supplemental, where you show new and relevant evidence of the condition. Okay.
Yeah, that's and when it comes to those decision letters, they are a gold mine of information. When you get a decision letter, dare I say, they're almost a blueprint for how to combat the VA's decision if you feel like it's wrong. And I bring this up because I think a lot of people that are tuning in right now have probably done this at one point or another. You get your decision letter in the mail, you open it up, you look at the first page, you see that it says they've denied the condition. You proceed to throw that letter in the trash and go watch TV. You don't want anything to do with this anymore. You you're throwing away a gold mine. Those decision letters, when the claims are denied, they have a rationale on it. It's not on the first page. You've got to read through the whole thing, right? But they've got a rationale as far as why the VA made that decision, why they denied it. And it's a blueprint, right? Because if in your situation, if that letter says that they denied it because you didn't have a certain piece of medical evidence that you actually, in fact, did have, I mean, your chances for an appeal just skyrocketed, right? But you won't know that if you just get discouraged and throw the letter out. On the contrary, if they deny it because they say you're missing certain pieces of medical evidence that you are in fact missing, but if you can set up a doctor's appointment and go get those pieces of medical evidence, boom, you just skyrocketed your chances right there of reopening that claim and having good success chances. So um, do not just trash those letters. They are just as important as any other part of this process. And with that being said, I'll go to a question that I saw here from James. I'm gonna hit this one up because I don't think this question gets asked enough. But he says, "How valuable is a 0% rating?" They're underrated, right? Not, I mean, no pun intended, but yes, a 0% rating is still extremely valuable, and it is not the same as a just denial or a not service connected. If you have a 0% rating for something, that means that it is service connected. It's just that the VA, for whatever reason, based on the medical evidence that exists, felt that you fall into that 0% criteria more than any other higher rating. But it's still service connection. So the hardest piece of the puzzle has been accomplished. If you get a 0% rating for something, you've proven to the VA and they have acknowledged that whatever that is related to your service. And from there, if the conditions, getting worse over time or something, it's much simpler to request an increase on something that's already rated than to try to go for a brand new claim for something that's not already rated.
Absolutely. And it segues to service connecting so many other conditions to that condition. You'll be surprised how many conditions you can connect with one rated condition. Happens all the time where someone's, 0%, and the other conditions that are out there that service connect to it. And then their rating just jumps up. It's amazing.
That's right. That is right. Now, since we're almost out of time, we got a couple of minutes. I'm just going to close it out with a quick recap. Like Coach Tony said earlier, if your questions did not get answered, just be on the lookout. Our team will reach out to you afterwards once the live is done. But again, book a discovery call. Figure out if we're a good fit for you. If you want to get signed up into our elite program, if you do, you will get assigned to a coach. You will have one-on-one coaching throughout your claims journey here at VA Claims Insider for the strategy, the education, the medical evidence, claim submission education, C&P exam education, all as part of that. Plus, you will have access to the live Zoom classes that we're doing. I mentioned earlier the coffee with the coaches, the mental health exam education classes, the medical exam education classes, all encompassing, right? And those classes are huge. There's always a couple of coaches on there. But figure out if we're a good fit for you because we would love to help if we are. Um, and also check out Brian Reese, our amazing founder's new book, VA Claims Secrets. That is available. You can actually get it on Amazon, but check that out if you can. And like I said, please book a discovery call, get the information. You've got nothing to lose for it. We would love to partner with you on your claims journey. With that being said, Coach Tony, it was a pleasure.
Yes.
Um, and it was also a pleasure hanging out with everybody that's tuning in and answering as many questions as we possibly could have today. Hopefully, you all have a safe rest of your day, night, morning, evening, everything in between, wherever you are in the country and the world. And please join the rest of our Facebook Lives. We do these most Wednesdays as well, and there's usually a different topic, a couple of different coaches in there, a lot of good knowledge that goes around. Thank you, everybody.
Take care, everybody. Thank you so much for your service.